It's going to be a great chat, hopefully. So we want to make this as engaged as possible. So we have a couple of questions to get us started, and then we will launch into our presentation. Slideshow. Get to on the slideshow. Why am I not seeing that up here now? Current slideshow. There we go. Thank you, Lindsay. Awesome. Hello. It's great to see some familiar faces on the screen. And let's see if we can open up my chat so I can see those come in also. Great. Let's see, what time do we have? We have a couple of more minutes and then we'll get started. But as I said, we're going to try a couple of tricks to see if we can get some engagement of the audience. And then we will have a discussion as interactive as we can with a virtual presentation. So to share some information. So certainly welcome everyone for joining in, especially at the end of a day. And I actually need to reach for my water and make sure it's available and grab it out of the chat. There you go. Excellent. So probably just a couple of more minutes to go. Well, maybe just a minute or two to go before we get started. So great, again, seeing some familiar faces, and I see a couple of names that are familiar also. You don't have to turn on your camera, but you're certainly welcome to. If you're eating, you're welcome to do that on or off camera, totally up to you. But I do want to take in consideration how precious time is, and that we want to make sure people can get multiple things done at once if they need to. But I do understand that that is important to the perimenopausal, the menopausal and postmenopausal woman, is that we oftentimes are doing many things at once in regards to taking care of ourselves. All right. So excellent. So I think it is just now at the 6:30 start point. So we're in part 2 of what's happening to my body, hormones. And it does seem as though here that we have a good crowd on the screen for us. I think we're right at 24, 25 people. So that's exciting to see so many faces. And actually, you know, if you can put in the chat if you were, you know, here in the first session. So maybe just to put a Y in the chat, saying that you were here the first time, and an N if you were not here the first time. So we kind of get an idea of who is new to the conversation, or those people that had the experience of having a conversation the first time. We'll do a little bit of a quick overview on information, and I do see it's quite a variety of people, some new and some that have not had the privilege of having the introductory conversation. So we'll do a little bit of an overview. So some of those slides will seem familiar to those that were on before. And so we will have that available. We do have a recording of this session that's going on, and we will have the ability to, you'll have the ability to review that. I believe that link will probably be accessible to the participants, I believe, and actually maybe the host assistant can put a comment in the chat about that availability of the previous recording and the current one that will be coming up. The some of the conversation that we're talking about today is kind of to elaborate on the introductory conversation that we had before. So some of it will be a little bit of a quick overview, and we'll do a deeper dive into at least two symptoms. We'll have a deeper dive in. So first, I'll do a quick introduction since I haven't done that as of yet, but I am Schquthia Peacock. I'm a family nurse practitioner at Avance Care Preston, and we're off of Cary Parkway in Cary. And some of my patients are on the call now, so I know they know where I am. But we are certainly, and I've been enjoying having conversations around hormones with people because it's, I enjoy the look in their eyes when they think that it's not just them, you know, that they're not alone in this journey. And that was the whole purpose of this seminar series, is to help people to realize that they're not alone. So the first thing that I would like to do is have a look at a picture, one of my favorite sunsets. I figured this would be a great way to start out and having an introduction and looking at, as we're entering into the evening, looking at a sunset over the ocean. This is actually one of my favorite sunsets in Belize. Very pretty, overlooking the ocean. So here we are. So I wanted to have a quick little introduction. Let's see if I could turn this on and see if people could participate in a quick poll. So you'll see a spot here that talks about how you can participate in the poll. You can do it by text or by web. And to participate, you can text SPACOCK 286 to the phone number that or the digits that you're going to text it to is 22333. So 2 2s and 3 3s. And you're going to text SPACOCK at SPACOCK 286 to that to participate in this poll. So it's going to enter you into the poll. And then I'd like to get an idea of where people are. If you can tell me where you live, I'm going to tell you how far spread we are, or how close we are together. And that will hopefully, we can use that to join in conversation. And hopefully those will pop up, into the, on this poll. I know it's popping up there. I do have one that's popped in. If you're not able to participate in the poll, you're welcome to put that comment in the comments, in the chat. All right, so let's see. I see it coming over here, but not over on my main screen. So I may have to read, oh, here they are. Have to read those out. So you can see those popping up there. So we have a Durham and a Cary, 2 Carys. We have a Sneads Ferry, Brunswick County, Raleigh coming into the chat. So that's good, seeing that people across the area. And far spread too, some out to the coast area. Have another Cary that's popped in. Into our chat, Holly Springs is popping into there. Apex just popped onto the screen. So good. So we see that we have a Wake Forest. We have another Wake Forest that's popped in, another Holly Springs and a Wake Forest has popped onto the screen. So excellent, excellent. So it's good to see that we have people in the immediate area and people that are spread out as far as the coast. Haven't seen anything come in. Oops. from the west. I'm just hitting my buttons here all over the place. But lots of carry right here in the triangle. So excellent, excellent. So I'm going to deactivate that poll and we're going to move on to our next one. And that is, I want to get an idea of the age of our population. I think it's going to scroll me through all of these. Let's clear those and move to our next. For some reason, my slides aren't progressing as I thought. Let's go that way. So here are, it's our next poll. So let me activate that one and see if we can get an idea of what our age range is. So I'm going to activate that. It's going to be done the same way. You can see the corresponding letters to the side to the age range that we're looking for. All right, so you can text those through. If you can, or you can put the age range in the chat, which works just fine too. Just trying to get an idea of what age range we're in. So we see as a lot of 40s to 45, or 50 to 55, or 45 to 50, 48. And it's certainly okay to put the age range in there too. So some 50s. We'll see that some of those symptoms are very common for people in their 50s. So we're going to see quite a few of those symptoms that are starting to show themselves, are starting to be probably more problematic in their 50s. However, a lot of people can have an onset of symptoms as early as their 30s in regards to that perimenopausal. And 40s is when it starts to intensify for a lot of people. All right, we're going to deactivate that poll and move to our next slide. As they're all going quickly. Let's see if we can go back. So we want to go to a definition about what perimenopause is and menopause is, right? We did this slide before, but I thought it would be a great overview. To give everyone an overview of where they may fall in the spectrum of things. So perimenopause, or first let's start off by saying that menopause is truly just one day in time. Menopause is the day that you have not had a period for a total of 12 months prior, right? So then that time leading up to that is going to be considered perimenopause, and those times after that is considered postmenopause. So that transition period for perimenopause can last 6 years or even more. I think mine was probably more in the 7 to 8 year time frame before I actually converted over to being menopausal. It can start in the 40s and late 30s for a lot of people. And this is a transition period that's present during natural menopause. People don't, I guess, always associate, or people can transition from perimenopause to surgical menopause in a natural place. All right. And if we then look over to what we have is menopause, again, it's when you have not had a period for the 12 months straight. That's 12 months in a row. So if you've had a period that you haven't had a period for 11 months and 25 days, and on that 26th day of that 11th month, you have a period, then you're starting that count all over again, right? So then people will have to enter back into that perimenopause and start that count of not having a cycle again for that full 12-month period of time before you can say that you're menopausal. People, like I said, can enter into a surgical menopause when they've had both of their ovaries removed. And that natural menopause age is typically somewhere between the ages, most people have had it happen by the age of 55, but textbook typically says on average is 51, but most people by the age of 50, 55, right? And then we have the thought of a way to confirm menopause for people, and that's usually typically done by a test called the FSH, which is measured by blood. And that test is can be ordered by a primary care or provider. Doesn't necessarily always have to be a primary care provider. And diagnosed as menopause, I classified as above 45. And if it's sitting right on the edge, or if someone is approaching 45, I may do a second test to see if it's confirmed to still be over what is textbook menopause, which can be as low as 35. But 45 is usually my break point. At any point when people are having menopausal symptoms, they can have a fluctuation between both the perimenopause and the menopause timeframe. So the symptoms between the two can be mixed. People can float between the two, as well as the hormone levels can float between the two. All right, let's see if we can just move up one slide. And so we see that represented here in this diagram, and that people who have normal hormonal symptoms before menopause, you typically have a rise of estrogen that peaks around ovulation, that then starts to drop off, and progesterone follows after ovulation, meaning a surge. And then in menopause, those numbers are not surging anymore. They're steadily dropping off over time. And so ovulation would be right here. So meaning if it started here, it would continue to drop and it wouldn't rise again on the other side of ovulation. So when we're doing a look at the FSH level, it's measuring the body's response to have the ovaries work, like the brain sending the signal for the ovaries to work to cause it to release more estrogen. So it's released and it's as a response, as a drop off of estrogen. Another measure that we sometimes check is called the LH, and it's looking as a response to what's going on with the progesterone. But typically menopause is diagnosed by a measure of FSH. So now we have a look at symptoms here. So this was again an overview of what we presented first in the first seminar, but it's an overview of some of the common symptoms associated with menopause. So we're going to pay closer attention to weight gain and insomnia, which I believe is on the other side of our screen here, under when it comes to interrupted or changes in sleep patterns. This is a pretty wide range of symptoms, but I wanted to have people give me an idea of what hormonal symptoms they are experiencing. So we can do that by entering it into the chat. And then let's see if we can get that activated. You can put that in the chat, or you can put it into the question, the survey, the poll that we just entered in by doing that same texting that 22333. You're going to put text Peacock 286 to it, or you can put that into the comments. Yes, weight gain. We're going to have a good conversation around weight gain, brain fog. We didn't have a lot of conversation around that before, but maybe we'll make a note to touch on that. So I'm going to make a mental note of that, and make me more than a mental note, because my brain fog is clearly a problem too. So I make a note that we can talk about it. Irritability, anxiety. Let's see, we had incontinence is one that we haven't talked about. Soreness is another that we hadn't talked about. But those are all very could be major symptoms around menopause. All right, so we're going to deactivate, and actually let's just go back and do a quick overview of some of those symptoms in the previous slide. Let's see if we can get that back. We might not be able to. get it back. So here we are. So hot flashes, joints, soreness and stiffness is a major one. We have incontinence and urgency is listed over there. Then we have a whole section in regards to vaginal symptoms. And the psychological one is that's probably the longest list, and probably the list that's probably least talked about by people. So I think that we need to make sure that we are sharing those concerns with our providers, your healthcare provider, to make sure that you're having your concerns or symptoms taken care of. If you find that you are having those concerns and you're sharing it with the provider and not necessarily taking them seriously, I would say to continue to press on to find a provider that's willing to listen. All right, so let's go to our next one here. And so let's talk about the outline of how perimenopause and premenopause and menopause seems to float, right? So premenopausal is from the time that you hit puberty all the way up to kind of maybe mid-30s or so for a lot of people. During that time, in the mid-30s or early 40s, people could have a change in their menstrual cycle. People either explain it as been more aware of their menstrual cycle, or they start to have more of a missed period or a heavier period during that time. So that's usually when people are entering into that perimenopause phase. And a lot of people have more irregular periods during that time. Weight gain or a change in their weight and distribution of weight is more noticeable. Hot flashes could be present, maybe more vaginal symptoms or dryness get present in there. It actually is listed in the premenopausal phase too. Insomnia kind of crosses between the premenopause and the perimenopause phase, meaning the time that you have not had as much change in your menstrual cycle would be in the premenopause phase. Then we approach into the menopause phase, usually in the 50s. Again, it's outlining at 51 as the average age here, but for some it can be by the age of 55. We see that people have more an exacerbation of the symptoms listed previously, especially around night sweats and insomnia. Irritabilities, that was one of the symptoms that people mentioned in our survey. And irritabilities, I think, could also be related to the lack of sleep, as well as the hormone changes that happen. Night sweats are listed here, and I wanted to bring out here is that we talked about night sweats being a symptom of estrogen depletion, and we always associate that with our ovaries. But there has been research and a new drug that's come out that has, they've done research to see that those night sweats truly could be a chemical issue in the brain. So it's not just a ovarian function. It could certainly be truly a function of chemicals interacting with our brain function. I'm giving it more validity, I think, and importance in regards to management. And then we talk about postmenopause. So postmenopausal is a more established menopause. And so that's toward the latter stages of menopause onset. So you're looking at that maybe in the 60s and over in regards to the postmenopausal phase. And I think I have a slide that's just under here that's going to help us outline that a little better. And here's another outline of the stages of menopause. So we have the normal reproductive years when our menstrual cycles are regular. Again, that is usually in our, starts to change over in the 30s or so, and would be considered the pre-menopausal phase that as represented on the previous guide. People usually having regular menstrual cycles here, a variable length in cycles here, and usually heavier, and then they start to skip menstrual cycles here. And then your final menstrual cycle would happen here. And that would be the onset of menopause, right? The onset of menopause, meaning that you've not had a period for the 12 months prior. During this period of time, hot flashes are present and may even be present in the early menopausal phase, depending on the person. It's very much individual. Then we have just offsetting that early postmenopause, meaning the period of time just shortly after having your last cycle, and then late menopause. And that's been more than 4 years from your menstrual cycle. Actually, I guess maybe I'm in late menopause technically, based on the onset of my menopause. And you can see the symptoms around menopause change as you go down this this timeline around menstrual cycle and menopause. All right, but what I do find is that insomnia can happen even in that early menopausal phase through here, as well as transition all the way through even to late menopause. So that's why I wanted to make sure that we brought it up, because I think it is one of the main symptoms that stretches across many of those phases of menopause. And then we have weight gain, again, bringing that up because it is one of the ones that I've had most patients have the biggest concerns around, because we're seeing a change in our body image. All right. I see someone put in the chat about what are hot flashes. I think hot flashes are very individual to the person, and the hot flash themselves, people can have a different presentation of them. For me, my hot flash starts with the warmth around my ears. For some people, it's a warmth in their neck. For some people, it's a sweat across their upper lip. Some people, it's a sweat across their brow. Some people feel like it's a wave of heat that kind of wave that crashes over them, like if it was a wave crashing on the beach, but it's very individual to the person, meaning the hot flash. And if you're asking what are they, you probably haven't had one yet, and it may be still yet to come, but just to kind of give you an idea of what they are. It's a sensation of warmth from the inside. And truly it's warmth that people could feel, like my husband could feel my body or the heat from my body, and wondering what's going on. And I just tell him to please go turn on the thermostat, because that seems to be the best response. And I think he's finally got it. I think he's finally understanding that adjusting the thermostat down is the way to go, not up. We want it cooler. Right, and now this is a picture. We're going to launch into a conversation about sleep. And I've chose this picture for a couple of reasons. Is that she's laying in the bed beside her partner, right? You can see the time here on the clock is at a little bit before 3, because I think it's a common time that people are waking up to have awakenings in the night. Not always is that as a result of hot flash. It can just be a increase in activity of the brain, meaning lack of being able to quiet the brain down. It can also be as a result, you can see the look on her face, a little bit of irritability, probably because her partner is laying over here sleeping soundly and maybe making noises when he sleeps, which is also very irritating to a already hormonally irritated female. You can see her arm is over her head because maybe, like I said, he's making noise in his sleep, and maybe using a pillow to kind of muffle sound to keep things quiet, to kind of quiet the thoughts that are in our head. See if we can get to the next one. So let's talk a little bit about some things that we can do to help manage our sleep, especially around the hormone changes. And so I think one of the things to pay close attention to, oops, looks like we're moving to the next slide, is to have a regular sleep schedule. So setting a regular wake time and a sleep time. I know I oftentimes find myself working later than I should, and I can miss my sleep signal, the way I describe it. When I get sleepy and I say I'm going to do a few more things, and I can miss it totally and leave myself stand up way later than I should. So I try to set a reminder on my watch to tell me when it's time to go to bed, so I can stop what I'm doing, turn off my technology, and do a wind down. It's what I try to do. So again, you want to avoid stepping outside of your usual sleep schedule. You want to also look at what's going on with your technology. So the light that comes from our technology can be activating to our brain. So having a turn off of that equipment at least 45 minutes to 60 minutes prior to going to bed would be great. I also, at a certain time, have my technology go to more of a night watch so that the brightness of the screen is different. I encourage people not to have very much napping through the early afternoon or evening to make it try and make it to your bedtime before you go to sleep. Watch your sugar intake, because sugar intake is one of the things that can have you more activated about the 2 o'clock or 3 o'clock window of the night. I've jokingly talked to many of my patients about waking up at 2 o'clock in the morning and thinking that we could all have, we could probably all have this Zoom call at that time, because many of us are probably up at that time, and between that 2 o'clock and 3 o'clock window. Oftentimes that can be related to sugar. It can be related to overstimulation of our cortisol circadian rhythm. Yes, in the last session, I did recommend magnesium, and that is one of the things that you can add into your regimen to help with sleep throughout the night. And magnesium is a good alternative for sleep, sound sleep. And there are a couple of that I usually recommend over others, and I'm putting them in the chat. L-threonate. Magnesium is also good at calming the brain, and it also helps with leg cramps, which is something I think also picks up through the menopausal phase. The dose that I usually recommend is 250 to 500 milligrams at bedtime. Magnesium is also good for cognitive function, because that's one of the symptoms that can come up in regards to menopausal symptoms. Having a regular exercise routine could be beneficial for having a good sleep pattern also. The more tired you are, the more sound you're going to sleep, which is one of the disadvantages for hormone changes around menopause, is that the soundness, the deep sleep, the REM sleep that we get is less when we're in menopause. So we wake up more often. We have more disrupted sleep, so we don't have sound blocks of sleep, long blocks of sound sleep. So we can oftentimes wake up not feeling refreshed and rested. To keep in mind also is that sound sleep, that REM sleep, is where we're doing the restorative things for our brain. So it's where you're storing memories. The reason that we can't remember someone's name may be related to our sleep pattern. So making sure you have better sleep so that we are less, so our memory is better around menopause. Avoiding having a large meal, staying away from caffeine, and remember that alcohol is not a great way to sleep. It's oftentimes even more disruptive to our sleep pattern than it's worth. So I usually have people avoid alcohol when their sleep is disturbed, especially around bedtime. Even though it may get you to sleep, it may not keep you asleep. So that's important to know. All right, I wanted to share a couple of things that, actually, I think this was a couple of tips in regards to sleep. I think I'm going to skip that survey, and we're going to go right into the things that I do for sleep. I've found beneficial for me for sleep. All right, we've already talked about the magnesium, and I put that information in the chat. And I put two things in that have helped me during that initial phase of insomnia. And that is good old earplugs, right? Earplugs are what probably has it kept me in the bed, let's put it that way. Meaning I have been able to sleep in the bed with my husband because of earplugs, because it makes it nice and quiet for me. So I don't hear any sounds. I have purchased numerous versions of this silicone earplug. It's a soft earplug, silicone based, so it molds to the ear. And it molds to the ear canal, so it totally occludes it. And they don't move, or they don't leave through the night. So with rolling over, they don't fall out. I've used that. And oftentimes at the beginning, I was actually using these two together. I'm not sure if anyone has heard of a sleep phone before, but what it is a headband that has ear phones inside of it, so that you can play some nice quiet, I call it my massage music, relaxing music through the night. So it helps me to kind of muffle the sound of anything else, even the dog barking, or so if you have little ones at home that may be difficult to use so that you can hear other things happening in the house. But I put at times where I actually use them both of them together, the earplugs and the sleep phones, just to kind of muffle out sound. Because my irritability was so high, any movement or sound that I heard was very disruptive to my sleep. Earplugs, this one is an Equate brand, but they also have it on Amazon, silicone earplugs. You can see that's a little circular disc, a putty that you can mold in your ear. And then sleep phones, which is a headset of headphones that's set in a headband that you can wear around your head at night. This may not be beneficial for all that are having hot flashes at night, but it is something that was very beneficial to my sleep pattern throughout the night. For me, it was probably in that perimenopause transitioning into the menopause phase where my sleep was most disrupted. It's not the best now, but certainly it's better with the addition of magnesium to the regimen that I do. Yes, that headband is on Amazon, and they actually sell it on their website, but I think it's actually cheaper on Amazon. And Amazon has a few other knockoff brands there too. All right. And now we're going to launch into a conversation around weight. And I was talking to a patient today, and I said, I need to go find a meme that talks about the struggle is real. Weight loss around menopause, because the weight around menopause and trying to get weight loss started around menopause is really a struggle for a lot of people, me included. But there's a few things that I think would be beneficial. We're going to launch into that, kind of giving an overview. The one thing I want to talk about with sleep before we go into a deep dive is that a lot of people who had sleep disturbances prior to menopause are likely to have sleep disturbances in menopause and postmenopausal. So working on sleep habits prior to menopause would be beneficial. So these type things could be instituted and started even prior to menopause symptoms developing in people. All right, so this is a kind of a pictorial of how weight distributes in our body over ages, over our age span, right? So in our 20s, pencil thin, no hips, no belly, no butt, none of those things were present much there. Developed more in the 30s, more of that developed in the 40s. And you can see that there's more of a growth of weight in the abdominal area. And unfortunately, that's a more concerning weight for people because you end up with fat around your organs, and that weight could be more hazardous in regards to vascular disease and cardiovascular risk. So that makes it even more risky in regards to cardiovascular disease. An important note to bring out is that when you have gone through menopause, so meaning that you've gone into that postmenopausal phase, is that typically hormone levels are dropping in regards to estrogen. And we're going to see that in another picture here in a second. And your cardiovascular risk around heart disease increases to meet that of a man. Heart disease is more common in the 50s for men. And as we enter into menopause, we know that the risk around heart disease and vascular disease increases the further you're away from your last menstrual cycle. And especially if we have an increase in weight around the mid area. And you can see that it's even more as we get older. If we're not being actively and making an engaged effort to make sure that it's moving not so fast or moving in the other direction. All right, here is an example of a pictorial of what's going on with estrogen levels across our age, right? So in our 20s, we're still not at our highest level of estrogen, right? That probably happens more in the 30s. And then in the 40s, it starts to drop off. In the 50s, here in the 60s, even less, minuscule amount in the 70s and 80s. And that's why we're seeing that weight distribution change in our bodies in the 60s, 70s, and 80s, and happening in the 50s because the amount of estrogen that we have on board. When that happens, we are not building as much muscle as we have been in the past. So when we're not building as much muscle, that means we're storing calories as fat. And when we are storing calories as fat, we're going to end up storing it in our abdominal areas first, or in the trunk area. So going from our trunk to our hips. that's when we typically see that storage. I certainly can see that change in the clothes size and the way that my dresses fit. All right, so now what can we do about it, right? This is some of the things that we can do. We're going to go over some of those tips. So one of the important things to do is to make sure that you're choosing healthy choices in regards to food. So you want to have whole grains, fresh fruits and vegetables, and you want to have lean protein choices. I typically have lean more toward the protein and staying away from simple carbs. So that those things that have more of a quick digestion when we ingest them. So that's simple carbs, sugars and refined sugars, breads and pastas, especially when they are white grain, not whole grain. And I typically like to have my grains and fruits paired with a protein or a healthy fat, because that can help slow the increase of blood sugar around those ingestions of those two meals, or those two types of food. You want to stay away from processed foods because those are going to be loaded with calories and oftentimes not the healthier calories. Dairy could be inflammatory for some people, so I put that on here. I would say to explore a couple of programs that you can use on your phone to monitor your exercise, calories, and caloric expenditure. You know how much calories you're burning, because that can help you balance your caloric intake as well as your exercise expenditure. Avoid late night eating. I typically try not to eat anything after the 8 o'clock hour because I'm less active during the evening hours. You want to limit or try and cut the portions of your takeout so that you're having less food when you're eating out. You have to keep in mind that when we're eating out, we're often being served a plate full of food that's more than what we would typically have at home. Having small, frequent meals can be beneficial, especially when they're protein rich. All right, so those are a couple of nutrition tips. We're going to go over a couple of exercise tips too. And what I have found to be beneficial, and what I find is a common struggle for women, is that our exercise routine, we say that we are eating the same and we're exercising the same, but we're still gaining weight. And we're trying to figure out what can we do to offset that. And the thing that I think that we can do that seems to be simple is that we need to change how we're exercising. We need to focus on strength and weight resistance. And so that means that we need to start lifting, doing strength exercises, and that can be as simple as weights, and it could be as simple as body weight exercises like lunges and squats and push-ups and things along those lines to help build our muscle mass. I did hear or listening to a podcast this morning, and I thought it'd be good to address is that using what we call compound exercises could be beneficial also, especially if you're going to include those into a HIIT training. So that's going to be jumping jacks. It's going to be exercise when you're using multiple joints. So jump rope, when you're using multiple joints, jumping jacks we talked about. Tree climbers is another one that you can use multiple joints as an exercise. Those are typically more high impact exercises, not as much low impact exercises, but swimming could be an example of a low impact exercise that you're using multiple joints. Tennis would probably be in the same category. Dance, so line dances a lot of people do to help with low impact options in regards to exercise. High intensity interval training. I'm not sure if everyone's familiar with that, but that's being able to take your exercise up to the highest level that you can withstand over a short period of time, and then having a rest period in between. A short rest, there's a couple of apps that can be beneficial for that. I'm going to put one that I use often called the Tabitha app, which helps to set an interval training for you. Actually, I think I'm direct messaging someone in particular, so let's try that again. Tabitha app. It's a phone app or a tablet app that I use to set high interval training sessions for myself. And keeping in mind that whenever you're adding exercise in, is that you want to be aware of how your body's responding to it so that you're not injuring a particular joint or muscle group. And you want to keep in mind that being active throughout the day is very important. That whole idea of 10,000 steps in a day is very important. And that can be included into your, that can be including the exercise that you're doing, but you want to try and push your activity up so that you're active for at least 10,000 steps a day. All right. Tips that can help with being successful in your exercise journey is to choose exercises that you enjoy, so I find for me is to do an exercise that I can do while I am in watching a TV show or a program on my iPad. I put that on my elliptical or on my stationary bike so that I could look at that. And that's almost like my treat, is that I can only watch that show while I'm on this machine, and then I can watch this show when I'm on my elliptical. I don't watch it any other time. So I look forward to then getting on one of those machines so I could look at the next session of my show. One of my favorite shows. I don't watch a lot of up-to-date shows. I look at a lot of old shows, so I can't give you any series that might be good, but maybe people could put a couple of series in the chat that they're enjoying that maybe other people could use as an option. To make sure that you are using supportive shoes. I find that making sure that helps prevent injuries to our muscles and our joints. And finding a buddy system or using a buddy system with exercise is also beneficial for that support. You can add in your challenges with a lot of your mobile devices that you can challenge other friends and family to participate in. Making sure that you warm up and stretch with your exercises. You want to change up your exercise to prevent boredom. So I use my elliptical machine and my stationary bike, and sometimes I walk outside. To make it successful to you actually initiating the exercise plan is to set a start date. You want to talk with your healthcare provider if you're new to exercise, just to make sure that you're not doing anything that is problematic. And then you want to consider consulting a dietitian if you feel like you need some additional information around diet, and consider consulting a trainer. I found that was very beneficial for me, especially when it came to learning about the strength component of exercise so that I can ensure that I had proper form. There are lots of YouTube videos that can give you guidance that way also. So, and actually lot on social media in general that you can watch. I consider myself doing a sofa run of it first to see whether or not it's going to be a fit for me before I dive in and realize that I've bitten off more than I could chew, or lift for that matter, right? All right, so benefits of exercise is that you can have an improvement in osteoporosis, a risk of osteoporosis, which is a risk after menopause. A drop in osteoporosis is a decrease in bone mass, a bone density. It also helps you to lower your metabolic syndrome risk, which is insulin resistance, the storage of fat in the abdominal area, reduces heart attack risk, can help manage blood pressure. It can help improve anxiety. I know when I'm exercising, I'm not much concerned about other things other than breathing and moving to the next level of my exercise journey. Let's see here. Oops. Uh-oh, y'all. Let's go back. I went too far. Trying to move my chat over. And it also helps keep your joints flexible and muscle strong. Regular exercise helps with regular bowel movements, helps to relieve and improve depression. We already talked about anxiety. And then general overall health. Blood pressure is better regulated when we're more physically active, and exercise, blood pressure is one of the things that can increase as we are going through the menopause journey. Yoga is also a great add-on, so I usually include that. I see some people are putting some information in about things that they have found beneficial on YouTube. And one of the ones that I found beneficial is Yoga with Adrienne. I'm not sure if anybody has used that yoga on YouTube before. yoga sessions, but she has done a great job of having a spread of yoga types of exercises and sessions that are from beginner to more advanced. And she does a great job of offering modifications for people. All right, so that was certainly a quick overview. Probably more could be done in both of those areas, but I do want to give a chance, a minute of time to allow people to put questions in the chat so that we can answer them. And there was one that came in. I'm just going to go back up the chat to see if any that we've addressed them all. We did talk about the magnesium types. I put that in the chat, and then someone asked about a particular brand. There are lots of different brands out there in regards to magnesium. Integrative Therapeutics is one. I've used Pure before. Orthomolecular has a good form of magnesium, but I do particularly want people to pay close attention to the type of magnesium. So magnesium L-threonate or magnesium glycinate is a great option when it comes to managing your sleep. Sleep, irritability, and brain fog can be addressed with adding a little bit of magnesium in. Are there typical chronic conditions that start in premenopause and during menopause? So yes, those chronic conditions, we talked about heart disease being something that could certainly be more evident and prevalent during menopause. Blood pressure increases. People have an increased sense of worry and anxiety. Depression could certainly start to rear its head more during the hormonal fluctuations around menopause. And actually, you know, that slide that we showed that was giving you an example of that swing in hormones. You have to keep in mind that that swing in hormones is something that people can have happen in a short period of time. So that swing from estrogen being low to progesterone being high is a part of that emotional state that could swing. So I always want to make sure that people know that that is a physical symptom that is validated by hormones. So it's not necessarily a symptom that we feel like we have a lot of control over, but we can do things to better manage it. All right, someone referenced how they enjoy the Tabitha app and Brooks sneakers. Actually, I enjoy my Brooks too. My favorite are the Ghost, but I would suggest you go into a store and try on a variety. There was a couple of things in the chat about YouTube videos that can be beneficial. And someone else put a thing in about another yoga session that could be beneficial on YouTube. Can you have spotting for a couple of days after being diagnosed with menopause? It depends on how long people have been since the diagnosis of menopause. So if you're still in that early post-menopause phase, sometimes spotting could be present, you know, a spot, but it probably, you know, if you're having spotting that's happening a year, let's say if you've gone a whole year without a period and you have had a spot in that first month, so on month 13, you know, maybe you're questioning whether or not you're still sitting on the fence in regards to menopause, and maybe having blood work, checking the FSH level might be beneficial. If you have gone 2 years and not had a period and you start having spotting, that needs to be evaluated. So I would suggest you schedule an appointment with your primary care provider so they can go over what those symptoms are that you're having around that time and see if any additional diagnostic tests need to be done. Having spotting after menopause could suggest that something's going on with the endometrial lining. It could suggest that you need to do another level of evaluation, as simple though as having a pelvic ultrasound, just to make sure that the pelvic line of the uterine lining is not too thick. All right. And if you have pain issues or about injury, a physical therapist could help. And once you get started, you can get, may only need, I can't see what that is under there. Let's see if we can make that go away. You may only need to see them once. So yes, physical therapy is very important. I think that's a great introduction to how to care for your muscles when they're injured and how to prevent injury in the future. So we use physical therapy a lot in our practice to help manage injury, and prevent injury. Any information on vaginal dryness? Yes, I do. And actually, I have a few things that I wanted to share in that regard. So I'm thankful for whoever asked that question, because I have a few samples that I wanted to show you to give you an idea of a couple of things that can be beneficial when it comes to vaginal dryness. Vaginal dryness is a major symptom for a lot of women and can be very disruptive to their quality of life, as well as their partner's quality of life. And it can cause a lot of stress, certainly can. As I'm reaching down, so I put a couple of samples in my purse, but I'm not pulling out all of them. So I'm going to step off the screen here in a second to grab my box. Let's see here. So I can get some more samples to show you. So one of the samples that I use in regards to vaginal dryness is called Astroglide. I'm going to put it here on the screen. Might be in reverse for you, but Astroglide, it's in the aisle when it comes to other lubricants and female hygiene products. That is one of the Astroglide. So that's typically the basic one. That's a gel. They have one that's a liquid also that is beneficial for those symptoms too. And it will come in a bottle that looks like this. And then we have one that is also water soluble. So when people are interested in water play, that can be used so it doesn't wash off so easy. But these are very slick, I would say. So be careful. If you're in a tub or a shower and you're using this, if you step on it and you're in a towel shower or just the surround of a shower tub, you can end up slipping, and we don't want to have that be a need for an ambulance to come get you out the shower because of lubricant. That may not be a good, it might make for a good conversation, but it may not be a good thing to explain to the ambulance driver. Yes, Life Extension brand of Neuromag is really good. Yes, and it does cross the blood-brain barrier. Yes, I didn't include that one. That is actually one that I do recommend too. And someone talked about meditation. Yes, meditation is a great way to help with relaxation and quieting the brain. So I have, that was one of the things that I explored around sleep. I didn't include it on my list, but it is a great one. So I'm glad Rachel put that in the chat. Meditation is a great way to quiet the brain. There are a couple of medication challenges that you can start. I've done several with Deepak Chopra. There's a couple of apps that are out there that can be beneficial. Calm is one. Headspace is another that can be beneficial for meditation. Those are just two to name a few. In regards to meditation, you can even take classes dedicated to meditation. And the OCD controlling person that I am, I've done several actually. Let's see, any other questions? Oh yeah, Insight Timer. I use that a lot to do my self-guided meditations. Could you speak on the symptom of dizziness and what causes it and anything that can be used to help? So dizziness is pretty broad. Dizziness has many different sources or etiologies. So people who have dizziness, it can be as a result of many things. So I think that's probably one of the things that could be evaluated in more detail with your provider, because dizziness is the options in regards to causes is wide, and the options in regards to management is wide. It can be as simple as neck tension for some people, but it can be as significant as a neurological or cardiovascular symptom. So to have that evaluated, I think it would be good. Is it typical to have normal to typical or normal to have long or heavy globby periods in perimenopause? Absolutely. Very crampy too. So people have a lot of cramps, And that's typically around a low progesterone for a lot of people. So when you're having your labs checked around menopause, it may be best to have an evaluation outside of than just looking at the FSH and LH levels, but to look at the individual hormones around menopause. And so people end up with significant anemia around that too, because periods are usually very heavy and very disruptive. People end up with accidents and bleeding through their clothes. It's very frustrating. I've had plenty of people crying either on the phone or in the exam room because of that, that irregular, heavy, cramping period that is associated with the perimenopause phase. But there are some things that can be done. So I would say certainly reach out to see. And actually, as I'm doing that, let me get to the next slide, which is another beach setting, a sunset. And I put information on how to contact me if you want to have that conversation around that. And then someone mentioned around hair loss. So hormones around hair loss could certainly be a big contributor to hair loss for some people. But again, it's a wide spray of potential causes around hair loss. But the imbalance around hair loss, imbalance around hormones can contribute to hair loss, especially around the crown. Some people notice a thinning around the edges, but there are a couple of things that can be done to help manage that too. So I would say to make sure that people are reaching out in regards to that, that symptom, making sure that you're having management of stress, making sure that you're having an evaluation around anemia and vitamin deficiencies are the things that I would have to have people focus on. And asking about particular vitamins that can be used around that. You know, people always talk about the hair, skin, and nail vitamins, but there are certain ones that we want to do a test of before we say you want to do a supplementation in regards to it. All right. Brain fog. Brain fog is real. Oh my goodness. If my medical assistant that works with me has a conversation with me about Schquthia forgetting one more thing, she'll probably scream, which is a good example around hormones making an improvement in that brain fog for some. What I used initially to help with brain fog was I took some additional omega-3s. So fish oil, flaxseed, chia seed are good ways to improve omega-3 fatty acids. And you want to do I usually tell people to do 2,000 to 4,000 a day. And those people who are patients of mine know that these are my favorite things to do, omega-3s and magnesium. And I think of those as the building blocks to all things good. Omega-3s, fish oil, flaxseed, and chia seed. Fish oil, flaxseed, chia seed, oils are all good sources of omega-3s. So if you did a search for omega-3 rich foods, omega-3 fatty acid rich foods, you'll see a list of things that are very beneficial, from avocados to chickpeas to almonds to walnuts, that can be beneficial dietary choices around omega-3s. But omega-3s are the building blocks for chemicals. Neurochemicals are the building blocks for our hormones. It's the building blocks for our cortisol. It's the building blocks for some of our vitamins are built off of fats, that those are essential. And I'm finding that a lot of dietary diets are lacking in those healthy fats. So to take it as a supplement, it's beneficial. So for a lot of people, having high dose omega-3s, especially when they have DHA in it, put that in the chat, is beneficial for the brain fog. But as I mentioned before, brain fog can be as a result of not having good quality sleep. So it may be beneficial to have a conversation with your primary care provider around sleep and that brain fog, just to make sure that we're not overlooking any potential contributing causes. All right, so we have actually approached our 1:30 time mark, and I want to make sure that I am very cognizant of people's time, and I don't want to necessarily go over, but I would like people to put in the chat, or I think maybe we were going to put up, if you could put in the chat before we end, any topics that you want, that you think would be a benefit of having a discussion about next. because I think the interest is there. And I think this is a great way to share information in a group setting, and making it convenient for others to share, in regards to things that they have concerns about. So if you have any particular things that you would like to have addressed in regards to not just menopause, but any topics that you would like to have discussed or shared in a similar webinar form, I would say to put it in the chat so we can have a look at how we can bring that information to you. Yeah, so good. Yes, that one thing I didn't mention, but yes, there are lots of things that can be done for hot flashes, and maybe that can be the next conversation. And how can we best approach those? So talking more about heart health, I understand that too, because heart disease is starting to increase within women in their 40s and 50s having heart attacks. So we want to make sure that we're doing as proactive as we can to prevent that chronic issue in females. We do not want to win that battle in regards to our male counterparts at all. I think a longer conversation around anxiety and mood, depression would be beneficial also. Insulin resistance and metabolic syndrome, osteoporosis. So it may be that we can put a combination of these type things into a session that we can bring those issues to the to our next webinar session. Also, is this time frame also a good time frame for people? That seems to work for a few, you know. And I think the idea of it having a recording is beneficial. Yes, intimacy and interest, that's a major one. And I think for people to realize that it's not for lack of wanting, right? To participate in regards to intimacy or sex with our partners. Awesome. Excellent. Excellent. So keep in mind that you can reach out if you have questions. We can have a more personal conversation around symptoms, which I would certainly love to entertain with each and every one of you. So I want to say thank you for taking time out of your day to spend it with me this last little bit. And hopefully one day we can end up seeing a sunset like this in the future, right? Isn't that gorgeous? Off the shores of Belize, looking off into the sunset. One of my favorite views. I wish I was there right now. Maybe I can do a podcast from there next time. Maybe that's what I'll do. A podcast from Belize. I think that would work. Thank you everyone for joining. And if you have any other particular questions, feel free to reach out to the office and leave me a message. Otherwise, until the next one, look out for that to come in your emails. Take care, everyone.